And get some thumbs up, even from our panelists. Can I see some thumbs up? Perfect. Awesome. Thank you, thank you, thank you, everyone. Well, again, good morning. My name is Marissa Montgomery, and I will be your host for today's virtual panel discussion brought to you by Advent Health. And for those who aren't familiar with us, this is a faith-based nonprofit organization, and we have a mission of extending the healing ministry of Christ. So we aim to provide whole person care to our team members, patients, and community. We have 4 service standards, and these service standards really help guide our approach to that mission. And those service standards are love me, own it, keep me safe, and make it easy. I am thrilled to have everyone with us today as we delve into the incredible work of one of our campuses, which is Advent Health Altamonte Springs. So before we get started, I do want to thank all of our viewers who are here with us today. So those who are watching live, and then also those who are going to be watching this recording. We appreciate you taking the time out of your day to learn more about Advent Health. I would also like to let everyone know that during this session, your microphones will be muted and your webcams will be off. However, you can communicate with us and ask questions via the Q&A feature, which some of our co-hosts will be monitoring. So please feel free to share your thoughts and questions throughout the discussion. If there is time left at the end of the discussion, our panelists will do their best to answer each question. And if we don't, we do have our co-host who will be accessible to answer the questions that we're not able to get to. So moving forward, we also have some exciting news. We have an upcoming specialty hiring event at Advent Health Altamonte Springs on February 13th from 9 a.m. to 1 p.m. And for all of those experienced nurses with us today, this event is a fantastic opportunity for you to meet our leaders in person for an on-the-spot interview. If you are interested in joining Advent Health, we encourage you to attend and have those on-the-spot interviews for a chance at getting a on-the-spot job offer. So more details about that will be shared in the chat. So without further ado, it is my pleasure to introduce our panelists for today's discussion. Panelists, if you could, would you please share your title, a brief overview of your current role, and how long you've been with Advent Health? And let's go ahead and begin with Nicole.
Hi, everyone. Thank you for joining today. My name is Nicole Crocker. I'm the Chief Nursing Officer here at Advent Health Altamonte. I have been with the organization for 30 years.
So thank you, Nicole. And then let's go ahead and move forward to Melissa.
Good morning, everyone. My name is Melissa Robinson. I am the Director of Imaging and Cardiology for our Seminole market.
And then how long have you been with the company, Nicole? I mean, Melissa, I'm sorry.
15 years.
And then Aaron.
Hi, good morning. My name is Aaron Mingy. I am Director of Nursing over our 2 surgical floors as well as oncology, and I've been with the organization 15 years.
And then Jill.
Hi, good morning. My name is Jill Cox. I'm the Director of Nursing for ICU, Respiratory, Dialysis, and 2 of the PCU units at this campus. I've been with Advent Health for 25 years.
Nice. And then John.
Hi, good morning. Thanks for having me. My name is John McCabe. I'm Director of Surgical Services here at Altamonte. I have the responsibility for the OR, outside OR, endoscopy, Rio, and PACU. I have been with the organization 3.5 years, in the surgical space 38 years.
And then finally, Josh.
Hi, my name is Joshua Allen. I'm the director for our emergency departments in Seminole County, and I have been with the organization for 17 years.
Well, thank you all again. There's a lot of tenure here, so that is just expertise, and I think just amazing at it in itself. So we are excited to hear from you and learn more about you and your journey with Advent Health. To kick things off, let's get an overview of Advent Health Altamonte Springs and learn more about what it takes or what makes this institution so special. Nicole, could you give us an overview of your campus?
Sure, absolutely. I would love to. So here at Advent Health Altamonte Springs, we have been serving the community since 1973. So that's 52 years now, and we're very proud of that. We have a 393 bed hospital with 2 offsite emergency departments and soon to be a 3rd offsite that we will be placing in Sanford. We employ over 2,000 team members. What I'm most proud of is that we're top rated in the country for safety and quality. We are a Leapfrog A organization, and we recently won the top General Hospital Award for 2024 from Leapfrog. And that's because of all of the amazing team members that take care of our patients. We offer many comprehensive services. I like to call us the leading tertiary center in Seminole County. We have cancer care, cardiovascular, digestive. I mean, I can name all of it. Women's, again, we have robotics. There's so many great things here. We do have the only level 2 NICU unit in Seminole County so far. So that's also a good thing to sort of highlight here. So yes, it's a great place to be.
That is an awesome overview. And there's just so many qualities of Altamont Springs that sets you apart, clearly with everything you just mentioned. So thank you for that. In addition to that, I wanted to open up the question to the team. What are some aspects of Altamont Springs that not only makes it such a great place, but sets the particular campus apart from other hospitals in the area, culturally and physically?
Hey, I can take that one and kick us off. So, excuse me. First of all, I would say culturally, we're a campus that we know each other. We develop relationships with each other, and that goes across units, that goes across departments. So wherever you go in the hospital here, you're going to know somebody, you're going to have a friend, you're going to have conversations in the hallways. So it's just a good, welcoming environment. And it's been that way since the first day I walked in for an interview and met our transporter, Arthur. So it's an amazing campus from that aspect. Physically, some of the things that set us apart, we are a DNV triple certified orthopedic and spine institute here. We are one of the first ones recognized in the state of Florida, and only one of about, I think probably 40 now in the nation that are triple certified by DNV for the quality of care that we deliver to our hips, knees, shoulders, and spines. We also have one of the premier head and neck programs for head and neck cancers in the state of Florida. We do procedures that no other campus is performing right now. We have people that travel from outside of the country, from across the U.S. to come here and have surgery with our surgeons and with our teams.
That is big. Thank you for that. Anyone else? All right. Well,
I want to say from my seat that again, it's like a family here at Altamont. Like Aaron mentioned, when you walk in, we know everyone. We are big enough, but yet we still have that family style. Like, again, you look up, you acknowledge people. I know people's families. I know what their kids are doing. It's just that environment that just breeds positivity. And again, when I come to work, I'm here the majority of the time. I'm away from my family, and this is my second family. So it's very important that we exude team and the love for each other. So that's very important. That's very important for me. And being a just culture, speak up for safety. Everyone has a voice. So I think those are some of the key qualities here at Advent Health Altamont. So it's all about team. I'm going to tell you again, I'm very proud of that culture and environment here.
Awesome. Thank you so much, guys. I really appreciate just the details you've given. The site that shows us how we are set apart from other hospitals in the area. So that is some great insight. I have also been told that Altamont Springs has gone through some renovations. So I want to ask 3 of our panelists about the changes because I know it directly impacts you. So Melissa, Jill, and John, with any order, could you all share what renovations are looking like or that have been happening on the campus and how it's revolutionizing the environment?
Sure, I can start. I'm sorry. Go ahead, Melissa.
No, go ahead, Jill.
Oh, okay. We're currently doing a beautification project in the front lobby of the hospital. Once this is completed, it's really going to create a serene and tranquil environment, which is important for our patients and visitors as soon as they walk through the doors to see that type of environment. We're also starting a renovation project for our intensive care unit. These renovations are going to enhance our ICU space and create a wonderful new feel for our patients and families, as well as staff, to feel proud of where they work. We're
Nice.
including a retreat room in the ICU for some of our staff to get some much needed relaxation when they're on break. Additionally, we're creating an intermediate care unit, which is going to consist of 9 beds and provide an option for those patients that still don't really need ICU level of care, but aren't quite ready for PCU status. These rooms are going to be set up like an ICU and provide our team with the opportunity to elevate practice within a PCU setting.
Nice. Thank you so much, Jill. Yeah, that's a lot of changes, a lot of updates, and I think it's just going to make the campus look beautiful.
Absolutely, it's exciting.
I can go next.
I think,
So
yeah,
like Jill,
awesome.
like Jill mentioned, lots of renovations in our area. For my area specifically for imaging and cardiology, the campus has dedicated a lot of resources and time into adding new equipment and services to assist our community. For my areas, we've had total renovations of our X-ray, pre-post areas for our procedural patients. So when they're recovering, the environment is nice and peaceful. We are adding new equipment to our X-ray area, and our cath lab area is undergoing renovations now for a brand new state-of-the-art cath lab. So we can launch additional EP services to our area. So we're constantly adding new resources and new services to meet the needs of our community. And recently have launched a couple new programs that are only offered at Altamont to treat patients with liver cancer. So we're really excited about those new services and the renovations to accommodate those.
That sounds awesome. Thank you so much, Melissa.
So I guess I'm next.
Yeah.
So in our surgical spaces and procedural spaces, we updated a year and a half ago 6 ORs, 1 through 6 of the 10 in the main OR. They are up to date, high tech. We are going to be doing 7 through 10 sometime this summer. So all 10 will be relatively brand new rooms. With that also, we were also undertaking an enormous project with the endoscopy suite, which is actually the gem right now of the CFD. It is huge, spacious, and we have 5 rooms to conduct business. And it is an incredible site when anybody comes from other campuses to either just experience it or to help us with our mission if we're short. And they love the space that has been provided and that Advent has, foreseen to grant us with to provide the care that we do. We are also looking into updating our SPD area. And we're just taking off to become that next tertiary campus with the services that we provide, as Aaron had mentioned before, especially to the ENT service. We've had patients come from as far away as Scotland to have procedures done with these 2 surgeons. And we also have 4 Da Vinci robots with the latest D5. We had that up and running in 4 days and started cases after its arrival. With that, we have a 5th robot coming for our outpatient area. So we'll have 5 robots by the summer. It is a pleasure. As Nicole said, it is a family environment. People just say it. The first week I was here, I could speak coming from New York. The first time somebody said, I appreciate you, I had to turn around and see who they were talking to. It is absolutely the truth for this campus. And I truly, truly love the team that I work with.
Awesome. All of these changes sound very exciting. And not only are they revolutionary, but they're also having an impact on our patients and employees, clearly. It's creating a positive patient experience, as well as creating a refreshing and safe work environment. So that is definitely key. And thank you all for sharing. I loved hearing about all of the transformations happening internally. So I am curious to know, what about Altamont Springs' impact externally? So Nicole, would you be able to provide a little insight on how Altamont Springs has, or even Advent Health has integrated itself into the community?
Absolutely. I think that's a big part of it. It's the well-being of our communities, because ultimately we're taking care of everyone outside of the 4 walls of the hospital. It starts with, our preventative measures. And so we have Advent Health as a whole has many partnerships with local, state. We want to pour into our community so that we have, more, better outcomes, healthier communities. It starts with our kids, right? So
Yeah.
we have academia partnerships with our local schools and universities to sort of
Awesome.
assess the needs of the community to see what is it that we need? What are those jobs that we're looking for? How can we help pour into the school so that we can create the best version of whatever career you want to go into? So we have
Yeah.
dedicated education units. We also have partnerships with local organizations. An example would be the city of Altamonte Springs. We promote whole person wellness through programs like hashtag Feeling Whole in Altamonte Springs. We do medical screenings, blood pressure checks. Again, when it's cancer awareness, Melissa and her team are out there with the ultrasounds, et cetera. We have the other thing we're very proud of here in Altamont is the Faith Care Network. So we partner with our local churches to see, again, having that broader perspective of how can we promote whole person care? And that's, again, it's mind, body, and spirit. We'll talk about that a lot. It's not only with our patients, but it's with our team members. We have financial contributions that we give to nonprofit organizations. The one that we work with a lot is the Sharing Center. That is, where they work with the homelessness, affordable housing, getting people back on their feet, which is great. So I can keep going on and on about all of the community involvement because we take very much pride in that.
Yeah.
I think another one that I just want to highlight a little bit is, again, when I say it starts with our children, we have partnered with our Seminole County Public Schools, and, again, it's about educating. We do hands-only CPR it's how can we help? And our teams go out, help teach the kids so that, again, it could be their mom, their dad, their uncle, someone on the
Right.
street that they're going to do hands-only CPR to give them that better outcome. So, again, very proud of the work that not only we do here for Advent Health Altamont, but as Advent Health as a whole. So
Yeah.
that's a little.
And I agree with, I think all of us do agree with everything that you just said. It's the impact in the community. That's where it starts. And I think we give people the opportunity to see that healing ministry. Again, not clinically, not just clinically, but also just in loving others, loving people. So thank you for sharing that. I can see why Altamont Springs is a great campus to work at, hence your tenure. But one other thing, Nicole, I don't want to pick on you. I wanted to see, how did you get into nursing? Like how has the mission of Advent Health impacted your career? And why did you choose this campus? What attracted you to it?
Where do I begin since it's been 30 years? I actually, I knew from, the time I was a little girl, I wanted to care for others, whether that was nursing or, but my mother, it starts with my family. So my mother is a nurse. She still currently practices. My father was in the fire service. So it was really a family that served others. And, I fell in love with it from day one. And actually, my mother has been with Advent Health now, I think, 45 years. So it runs in the family because it's a great organization. And that's how my journey started. And I will tell you that the mission speaks to me. It's really about, you have that, it's the calm, the peace when you're caring for people. You have that moment. If you want to pray with them, you can pray with them. And again, it's the whole person. And I think that's what resonates with me. It's not just about the medical portion of this. We do evidence-based practice. Everyone knows if someone walks through the hospital, they expect for you to be competent in caring for patients, right? We all went to school. We all have degrees. We all did our training. What they don't expect is that you actually look beyond the diagnosis and take care of them as a person.
Yeah.
It could be, I have a social situation or my mental well-being, and it's really taking that time to pause and say, what exactly is driving this? Why are they coming back? Why aren't they taking their medications? And that speaks volumes to me because sometimes it's not, I need to dig deeper, and we allow our team, again, it's praying with the patient. It's taking that minute when even our environmental services go in and they have that moment to pause and be with the patient and just be there, be present. That's why I have stayed. That's why I love it. That's why I promote it.
Yeah.
Advent Health, again, it's endless opportunities in this organization, no matter which career path you choose. So I think that's and I just love caring for people. So in this position, I'm able to be an advocate for the team, because again, it starts with the team.
Yeah.
And then they can be advocates for the patient, and it's just that trickle effect. And then just pouring love into others. So I hope that helped.
Yes, thank you so much for sharing. I love that. I can level with you on, Advent Health, the mission being a great place, and even the extension into the campuses, how it kind of just moves. It's an environment that we strive to create to give patients and employees that unique experience and positive experience. So thank you so much again. I want to open up this question to our panelists now. In your opinion, kind of extending what we just asked Nicole, what makes your campus an amazing place to work for you? And if you could share again how long you've been there and what keeps you there.
I can start. I started my nursing career at the Orlando campus, which is our biggest flagship campus. I worked there for 24 years, and now I've been here for almost 2 years. I absolutely love the Altamont campus. Altamont's currently the second largest campus. We have 400 beds at this campus, but it has a small campus feel. And I think that's what I like the most about it, and what I anticipated liking the least about it, but now love. You walk through the hallways, as Erin and Nicole said, and you recognize people by face and name. They smile at you. It just makes you feel good to know who you're working with, and sometimes know a lot about that person. Everyone is friendly. Everyone's always smiling, which speaks to me and says that they must really love the place that they work. That means a lot to me. We spend a lot of time at work, sometimes more time than we do with our own family. So, you really do want to love where you work. And I pride myself on always wanting to be somewhere that I love. And I absolutely love this campus. It's been a very good fit for me.
So thank you, Jill.
I can jump back in on that. And again, it's the same, referencing back to what I said earlier with the culture of the campus. When I worked for 2 years in Tennessee before moving here, again, I've been here 15 years this September. And coming down here, my last hospital, it was perfectly wonderful location, and it was a wonderful facility and everything. But I remember coming down here, and when I came for the interview, I walked in the door, I was lost, and there was Arthur, which he has retired, and he comes to visit us even now because he misses us so much. He welcomed me, he walked me where I needed to go, and everybody throughout was the same way. So everybody takes the time to stop and pause and welcome you and show you where you need to go. And I remember leaving from that interview thinking, wow, those are the nicest people I think I've ever met. And it's continued that way. And so for me, I've been excited to be able to continue that legacy of being the nicest people I've ever met, and welcoming people to the Altamont campus in the same fashion. So for me, that's what keeps me coming back, and knowing that any person on this call here, I could call them at 2:00 in the morning if I needed help with something, and they would pick up and they would be right there to assist. And so that's what keeps me here. This is the only campus I've worked at since I've been in Florida. So that's my reason for being here.
Thank you for that. Anyone else? Okay. Perfect. Well, thank you guys so much for kind of giving us a peek into your minds as what it's like in your workplace and why you're there and what keeps you there. So I'm gathering a general consensus that Advent Health Altamont Springs is worth applying for. So thank you. And considering that we may have some RNs or aspiring RNs on this call, I would like to dip into some questions that may give them some insight on what it's like working as a nurse for Advent Health. So just Advent Health Altamont Springs. So Jill, would you be able to tell us what a typical day is like for your nurses on your units? Because I know you cover a plethora of units.
Yes, absolutely. Well, as you know, there's a lot of different aspects that nurses can do. So Advent Health Altamont offers a variety of different things for nurses. But from an inpatient unit perspective, nurses start their day with what we call bedside handover. This is an offgoing and an oncoming shift, providing report to each other and including the patient in the plan of care. This gives the patient a great opportunity to clarify anything or ask questions for both shifts so that they feel like there is a lot of questions answered, and they feel like that they're integrated in with that next steps in care and what their plan of care actually is. Throughout the shift, we collaborate with physicians, other multidisciplinary team members, family members, and the patient, really to provide excellent care and to set the patient up for success, whether it is that they're going home or setting them up for success for transitioning to the next level of care. We also provide ongoing physical assessments, medication administration, appropriate documentation, test coordination with other departments. And, at the end of the day, one of the most important things we do is provide whole person care for that patient. We try to make sure that we meet every aspect of what they need so that they feel cared for, listened to, and confident in the care that we're providing.
Awesome. Thank you, Jill. That sounds like a busy day. So that's a great visual to have of what those tasks look like. And I like how you said preparing them, whether it be going home or going on to the next level of care. I think that's very important. So
Absolutely.
thank you. And I understand that every day is the same, especially with so many units in a hospital. There is always movement, there's always shifting and focuses throughout the day.
Absolutely.
So, especially considering that time commitment for clinical staff to make to their jobs, I can see how work-life balance is a big question for employees. So, Josh, considering you are the director over the ED, which is normally a very fast-paced environment, would you be able to speak on what work-life balance looks like for the nurses at Advent Health Altamonte Springs?
Yeah, absolutely. So I think, Advent Health has a very good PDO policy. Obviously we want people, to be dedicated to their time at work, but also dedicated to their families and the things they have on going on outside of work, and to be able to, have some respite and go and relax a little bit and come back to work and have recharge. So, we're very focused on work-life balance in that way. However, at the same time, I think work-life balance has a lot to do with your time at work. And so I think what I have seen in the 17 years that I've been here is that, and it goes into a lot of what, some of these other folks have been saying, is that, like, we're a big family. And so you really feel supported. Nicole, our CNO, talked a few minutes ago about, how she's really like an advocate for the team. And she's a big patient advocate, but she is an advocate for us. And so really, listening to our needs and what kind of support we need. It's winter time right now, so the ED is a little bit busy. The hospital is a little busy. And so there has been, even, just in the last couple of weeks, so much. I mean, every single person that's on this panel, the contributions they have made in support to the ED team and to those patients, it's huge. And it's actually one of those things that makes you feel like you have more balance at work because you're not trying to do it all. And that goes right down to the frontline level of how the nurses and the rest of the team take care of each other, right? I mean, it's the ancillary teams, it is the housekeepers, it is the patient registration reps. I mean, they really all pull together and create an environment that everybody likes to work in.
So thank you so much. That is great to hear. Work-life balance is crucial to having a healthy workplace culture, and it also influences the morale of the team. So thank you for touching on that. As leaders, what are some other things that you do on your floors to increase the morale of your team? Speaking on that.
I'd like to take that one.
Yeah.
So, I come from an experience level where team is everything, especially in the OR, especially in procedural spaces. You can't do it by yourself, just like Josh had said. And there is no I in team. And as cliche as that is, leading by example as directors, and I could speak for myself when I first started here, my first role there, when people say, well, what do you do first? Well, I go in the rooms and listen. And I also help lift patients off the table, onto the stretcher, onto the bed, so forth and so on. Yes, as a registered nurse, as the director, there are no clipboards in our roles, and the only clipboard should be with the count sheet in the operating room. And I truly believe that by showing the staff, as I said, I have 38 years. I started as an orderly. I was an orderly, combat medic, then became an RN, onto my bachelor's, then my master's. So it took my entire adult life to get there, but I'm there. And I truly believe that when you come up the ranks in that respect and you show the teams that there's no job I'm going to ask you to do that I have not done myself, it is a tremendous morale boost, as well as what we do as leaders, rounding for our HCAPs, for our responses from the patients, having those responses come back and being able to show the staff, this is what you do and this is what comes back, I think is a monumental example for the staff.
Awesome. Thank you so much, John. And then you're in surgery. I want to hear the other side of surgery too. So, Erin, do you have any intake on what are some things you do to increase morale on your floor?
I mean, a lot of it is like John. It's building that teamwork. It's getting to know your employees. So, rounding on staff, getting to know the individuals, knowing their families. They know my family. From pictures and stories and stuff. It's really building that sense of you can rely on me to, I will take your patients to the bathroom if need be. If they have an issue where they need immediate assistance to move a patient, I'm right there with them. And so knowing that they can rely on me helps me to know that I can rely on them as well. So it's a lot of that. We also do a lot of fun stuff. So we push our unit practice councils here as helping to build teamwork amongst the teams. They do a lot of fundraisers. One of my teams, I have to brag about them a lot, my oncology team, they do a lot of bake sales. And what they do with the bake sales is they then identify families or patients that have been with them because they're there for longer periods of time. They develop relationships. So they'll sponsor a family for Christmas. So they will do a bake sale to raise money to then sponsor that family for Christmas and buy presents for them. They do a lot of community stuff like that, where they come together as a team to give back to the community. So that's a lot of what they do. My managers and departments, they also work closely together on process improvement and stuff like that. So it's really avoiding silos and making sure that we're all moving in the same direction.
Yeah. Those are some really good initiatives. Thank you again, John and Erin, for your input. I know that being a director and being in a leadership position, it's a heavy weight to kind of manage teamwork and balance within your space. So I applaud each and every one of you here because it seems like on your mind, it's not just you. Everyone here has that same care for others, and especially having your employees feel at a good space working in your units and at Advent Health Altamont Springs. So I truly appreciate your intake. I also want to say that just me being an employee too, it means a lot when you give us like the autonomy, when you give us that sense of purpose, reminding us of what we're working for. It changes the perceptions every day of coming into work and seeing others and loving on them. So thank you again for sharing. So after hearing all of these amazing things being done at the campus within the units, I want to shift the focus a bit to the opportunities available at Altamont Springs. So considering we do have the hiring event on February 13th, could either of you share with us what positions and areas you're hiring for?
Sure. I can go first. So in my areas, I have lots of different specialties, lots of different opportunities. And with us opening our new offsite emergency room soon, we're really looking to hire a lot of people. And we'd like to grow our team members as well. So for my areas, we're looking for CT techs, and we are not opposed to cross-training X-ray techs into CT, MRI, ultrasound, and some of our bigger areas that we have a need in is our cardiac cath lab space. So a unique thing about Advent Health is that in our cardiac lab space, in the procedural space, we can hire an RN, a rad tech, or a respiratory therapist, all in the same role to do the same function, and we will assist them in training. So that's a really wonderful opportunity for someone who wants to be in a procedural space, but maybe their background is rad tech or respiratory. This is a wonderful opportunity. So we're looking for people and those services as well. We also have opportunities for echo sonographers, or cardiac sonographers, and pediatric sonographers. So a lot of opportunity. And again, we like to grow within. So if you have an opportunity to come out and interview with us, we're always looking to grow you.
Awesome. Thank you, Melissa. And then questions open again to anyone else. But chiming in on this question, Melissa, what are you looking for in a candidate?
Oh, and a candidate. So typically when I'm interviewing a candidate, of course, skill is important, but I also am looking for someone who is mission aligned, that would culturally fit with our team as well, that displays the service standards that we look for in our employees. So it's not just about, do you have years of experience in that specific job that you're applying for, but really, do you show that desire? Do you exude that love for people and what we do every day? That those people deserve opportunities. It's not just about what you've done in the past, but it's where do you want to go in the future, and what can you offer to our team? I really look for that in a team employee.
Thank you, Melissa. And then anyone else, would you like to share what you're looking for in an ideal candidate?
Yeah, I'll share. So one, I will say we're hiring for nurses. So if you're an experienced nurse, you can certainly go on and apply. Really what we look for in a candidate is obviously we want to see skill, like Melissa said. We want someone who's clinically strong. We have a graduate nurse program, and so if there's somebody who wants to go through that, obviously we're going to teach you what you need to know as well. But no matter what, I think it really comes down to passion and about caring for people, about teamwork. That's really what we're looking for. We can teach technique, we can teach some of the skills, we can teach those clinical pieces if there's something missing. So I think obviously an openness to and a willingness to learn, that's also important. But I think nothing replaces the passion that you have to actually take care of people, and wanting to connect with them on their level and at whatever space they're really in. Because you think about the emergency department, people come in for all sorts of things, right? They come in for very minor things, and they come in for very, very serious things. And so it sort of takes like a broad approach in how you deal with people every day. So people skills are very important.
Awesome. Thank you, Josh. Anyone else want to chime in on the question? All right. Well, thank you so much, Melissa and Josh, for that intake. I want to consider how most applicants are individuals we haven't met before. So many times first impressions are given through the resume. Josh, I want to ask you again, not again, but just kind of further the question. Do you have any resume tips for our applicants?
Yeah, absolutely. So one thing I see often is that people have experience in other areas outside of healthcare, and they don't put it on their resume. So I'll be in the middle of an interview, and they have maybe very little clinical experience. And then in the conversation, come to find out they've actually been in customer service jobs, or they've even had other leadership roles or whatever, but they didn't put it on their resume because it wasn't clinical. And truly, I think I actually love it. I did other things before healthcare, and I certainly use those skills today that I learned in those jobs.
Definitely.
And I think it's an important thing that sometimes is missed. So all of your experience is important. And I think also whatever you can get through, if you're doing things in the community and it shows your passion, putting those sort of extracurricular things that you do on your resume can also be helpful and help us get to know you.
Awesome. Thank you so much. And I remember hearing one of the managers too, just specifically, like you said, non-clinical experience can be so applicable to the clinical realm. So for example, one of the managers I was able to speak with in my past, she is over the ED, and she tells me that sometimes she looks for individuals who have worked in the restaurant business, because in the restaurant business, you are always on the go. It's so fast paced and you have to pivot every so often. So she can see how some of those skills can be easily transcribed into the ED or in the surgery department. So it's a really good tidbit to give candidates that insight to say, don't be afraid to put that non-clinical experience on your resume, because those skills are key fundamental skills to be able to function successfully in the unit that you're applying for, or even just as a nurse or a PCT. So thank you so much for that. Those are really good recommendations. So we've touched on some things regarding experienced nurses. Going back to that clinical space where we don't have experience, I also wanted to bring up highlights regarding our graduate nurses, which was definitely mentioned probably like 3 minutes ago. So Erin and Jill, would either of you be able to speak on Advent Health's dedication to graduate nurses? We can go ahead and start with Erin.
Sure. Yes, we love graduate nurses. I am a big fan of graduate nurses because you can train them to be excellent nurses. You can train them in the habits and cultural alignment with the organization. So I think it's wonderful. Advent Health has a very robust graduate nurse program through our preceptors. All of our preceptors take additional training on how to be an effective preceptor. Our graduate nurses then go through an extensive preceptorship where they will go through classes that teach them core values for Advent Health. It will also teach them core clinical concepts for Advent Health, and then they do elbow to elbow preceptorship for the remainder, depending on if they're going, what acuity they're going into. If it's acute, intermediate, ICU, etc., it will change a little bit on how many weeks they will receive. But they receive a very extensive training program to help support them. And then even after they are out of their preceptorship, there's still a very strong expectation that you'll have questions. We want to answer those questions. We want to continue to grow you and support you through your journey into being an experienced nurse. And we love to promote and grow our nurses all the way from, being at the very beginning of their career as nurse techs and CNAs through nursing school and wherever that may take them. So we love our graduate nurses and invest a lot in helping them to be successful.
And I'll add to that. Last year, we started what we call a DEU. It's a dedicated education unit, excuse me. Typically what happens is when students are in their clinical rotation, they arrive on a Tuesday, Wednesday to the hospital. They don't know who their preceptor is going to be. The preceptor doesn't know that they're going to be training that person for the day. So it sets both the preceptor and the graduate nurse up for, potentially not having a great day because they come in and it's a little stressful. So what we did at the DEU is we pre-select a handful of preceptors that are engaged and really enjoy teaching, and we assign them to each student for the duration of the rotation that they're there. If they're there for 6 weeks, they have the same preceptor for those 6 weeks. What that does is really create a sense of security and confidence for the GN, so that they know when they come to work, they get to know the personality of the preceptor. They get to learn a lot more because their confidence level is higher than what it would typically be with someone they don't know. They also learn the unit. They know where supplies are. They know the other employees within the unit. So those team members within the unit tend to look at them more as one of them. So it just creates a better environment. We've had a lot of success with this program. The feedback that we've received from students has really been remarkable. They feel more engaged in learning because they're comfortable with their preceptor. They're on the same unit, as I said, each week, so they get to know the rest of the team. Feedback from our preceptors, they feel this process really sets the student up for more of a realistic view of what nursing will be like, and also builds on their clinical skills. So when they do start their practicum or they have their first GN position, they're really ready and have been exposed to so many more aspects of nursing than they would have elsewise.
Yeah.
We actually now work with multiple schools to provide the DEU experience, and we've expanded this to our med surg and our PCUs. So we've got 4 or 5 units now that do DEU. So it's really been successful.
That is awesome. Those are great initiatives for our graduate nurses. Definitely being a graduate nurse is such a unique place to be, especially with someone who has never worked in the medical field before, but has that deep passion for serving others. I think the hospital can sometimes be daunting, And having that easy transition into that experience or that professional experience space, it it's definitely vital to, like you said, build that trust and confidence within that graduate nurse or new employee coming in, so they can have that positive experience. So
Absolutely.
I want to kind of extend the question now, Erin and Joe. What are some characteristics that GNs are lacking right now out of school in the eyes of nurse managers? And what are some characteristics of new nurses that managers look for? So we can go ahead and begin with Erin again.
All right, excellent. No, I think some of the things that our GNs sometimes are lacking is a confidence in asking questions. Again, you're a new nurse, and we want you to learn how to do your job. We find a lot of GNs are timid about asking questions for many different reasons, and so that's one of the things that we have to work on the most is getting them to ask those questions, getting them to clarify things so that we can ensure that they know the most effective and the safest ways to provide care. And then some of the things that we are looking for, we're looking for people who are eager to develop relationships, eager to communicate, eager to just care for others and be open to growth, because we're all constantly growing. If we're not growing, we become stagnant and we're going behind. And healthcare is always focused on how can we improve and how can we change to do things better, and base our changes off of evidence-based practice. And so we are looking for GNs who are eager to be part of that, eager to look for that feedback and how we can support them and help them to change and do better.
Yeah, and I'll add to that. One of the things that we have noticed with having the DEUs, we always have a welcome breakfast for them, and we always kind of go around the room and ask each student, do you currently work anywhere? Are you working within the hospital? And what are your goals when you graduate? We've had a large number of GNs in the past year that really want a specialty unit such as L&D or mother baby. As wonderful as that can be, we feel that having a foundation in nursing is crucial to setting the GN up for success later in their career. Once you have a foundation in nursing, you really can go wherever you'd like to, and then be able to elevate your practice in a higher acuity environment. Once you get those necessary skills, that's really what you need, and it puts you on a successful path. At times, when you take a GN into a specialty area such as L&D, they may not be successful because they haven't had the tools that they need to really learn critical thinking and the other aspects of that role that they would need in order to be successful. And that really starts off their nursing career path in a negative aspect. And we never want that. You want to start off with a foundation and always build on that foundation. I think it's really crucial for nurses to be able to do that, and it increases their confidence and their ability to move into higher acuity areas. One of the things that I think that nurse managers really look for in a GN are engagement in the learning process, like Erin said, asking thought-provoking questions on why we do what we do. If we don't ask the why, then we really don't understand things. And that asking why really does teach you how to be a nurse. It teaches you how to critically think. You can learn a lot of things in nursing school, but you don't learn everything out of a book. You learn things in real time with real patient situations, and asking those thought-provoking questions on why really does set you up for success. And we also really look for people that, I think Josh said this earlier, having a passion for nursing. If you have a passion for nursing and you genuinely love what you do, you're going to be successful and you're going to be an exceptional nurse. And those are really things that we look for as qualities. And it shows in everything you do when you have a passion and love for nursing.
Awesome. Thank you both so much for that feedback. Definitely gives some great insight to those in school right now for nursing or just graduate nurses that just graduated. So definitely appreciate that. As we wind down.
Yeah.
Oh, yes, please.
So just for the surgical space and procedural spaces, it's a little different as far as the path. For graduate nurses, we have OR NIP program, and they have an up-and-coming endoscopy NIP program, which takes nurses that have no experience at all in those spaces and cultivates them over a 8-week period. But it doesn't take 8 weeks to be able to do it on your own. It's a good 6 months before a surgical nurse is flying on their own. And especially if they're going to scrub as well. We also have surgical techs in that space. and which are in great need and commodity throughout the country. We do show the years ago, the thinking was you had to be a nurse on a floor before you joined into the surgical space. That kind of thinking has definitely gone by the wayside. It is a different type of nursing. It is a procedural, high tech, high paced, and ever changing in the rooms, the technology that we deal with every day. So it is another avenue other than what both Aaron and Jill were describing. And that's the beauty of nursing, is there are so many avenues and turns and pivots that you can take to extend your career.
Absolutely.
Definitely.
I would like to add to that. I think the nursing directors have outlined that very nicely. Whether you are a nurse graduate, whether you are an experienced nurse, there's so many pathways. And what I want to sort of outline is that we have personalized plans for each nurse, whether you're starting, you're in the middle of your career, or you are looking at something totally different. We meet with you one-on-one to say, where do you want to be? And how can we work with you to get you there? So I think that's what I love the most about it. As we all mentioned, we have an amazing nurse resident program here, and also other programs that help. But it's really about that personalized career growth plan. And if you have the passion, we will help get you there. Again, I started as a unit secretary at 18 years of age. And like John and everyone else on this call, you've worked every position. Again, I went into emergency medicine. That was my path. And then I broke off and went to other. It's just that it's endless opportunities to grow at Advent Health. And we are so fortunate. And we love to sort of showcase that. And again, very blessed to have all of these resources that we have, and we can actually walk people through what does your future look like and how can we help assist. So just wanted to add that. Thank you all for outlining.
Yes, thank you. I mean, each and every one of you, thank you for giving that insight. It's encouraging to show how much we invest in the education and the development of nurses, whether they be graduate nurses or experienced nurses wanting to shift into their shift focuses or their specialty. So it's encouraging because not a lot of hospitals offer that. And I think that's something that needs to be highlighted as a priority because it's the next generation, that's coming up and eventually is going to be over the healthcare space. And then we need nurses who have the knowledge of multiple areas too, to be good teachers, to be good preceptors. So those are some awesome initiatives that are happening. Nicole, you brought up just extra benefits that we do offer to graduate nurses, experienced nurses. In addition to that information, what are some other benefits that Advent Health has to offer to our employees?
Oh, so many. Again, we're very blessed in that health insurance, that's very important for me, my family, that, you have medical coverage available the first day of employment. I've never have heard of that before. So that's pretty amazing. Paid days off. I know Josh mentioned that. You receive PTO as soon as you're on 24 hours. We have self-scheduling here for our nursing teams and other teams. It's, we try to be as flexible as possible because we do want the work-life balance and balancing, caring for our patients. We have the debt-free education assistance, the student loan support. We have mental health resources, something that is very, again, at Advent Health, but at Advent Health Altamont, we have a mental health counselor, Betsy. We love her. She's here for our teams. We also have, who partners with our mental health resource, is our chaplains. I don't think we speak enough about what they do for us. Again, they're there for our patients, but they're there for our team. We have that. We have wellness programs. We're all about, again, whole person care, which includes our team. So we have that, and then again, I say it and I'm going to keep saying it's the professional growth opportunities at Advent Health. They are endless. So those are all of the things that I like to highlight about Advent Health. So, and I'm not sure if there's anything else that anyone else would like to talk about that I could be missing.
For benefits, I know we offer, I believe it's like, is it the pet insurance that we're offering too?
We
Yeah.
do have pet insurance. Yes, we do, because our pets are very important to us. And, again, there's a lot of that's absolutely that we listened. That was put out in a survey to our team members, and they brought this up that was one of their priorities. And Advent Health, they changed, so that was a really good benefit.
Awesome. Well, thank you so much. Earlier in the discussion, we briefly touched on our mission of extending the healing ministry of Christ, and as you just brought up, Nicole, whole person care. So I believe that our benefits are one way we do that for our employees. But then, what is another way? And as we close down our discussion and close out, but how is whole person care really incorporated in how we take care of our patients, and how do we express and live out our mission?
I think that we mentioned this earlier, but I really believe that how we incorporate this into our care, it's not just the physical need of the patient, but it's their emotional, their mental, their spiritual, and their social well-being. And that can be from, again, having the chaplains, having our team members pray with the patient. I have a lot of examples that I could provide you of how I've actually witnessed our teams. One example I'd like to bring with, again, whole person care is not only, again, providing the medical portion of this, but we had a patient that was, having a rough time. People might say, oh, a difficult patient, we need to get him back, in the room. And they were just a little unruly. And our security officer noticed that the patient was struggling, and they were able to pray with the patient. Just that's all that it took. It wasn't medicine. It wasn't any tests that we needed to do. It was really looking beyond what was going on and really taking that time and praying with the patient. The patient calmed down. That's whole person care. When our ICU nurse realizes that someone is, they want to get married, but the patient is really sick, and we can actually pull together in about, let's say 5 hours, Jill, I think it was, we were able to pull together a wedding ceremony for a patient. That's whole person care. When we have even our own team members that need care, I'll use myself, for example. When I need something, anyone on this call, again, any team member, I'll use Melissa, our radiology and cardiology director. Melissa, I'm really scared. I need to get a particular test done for my family. I don't even have to ask. She's already mapped out everything that needs to happen, and I get it done and I get a result. That's whole person care. I mean, I can go on and on about the things that we do that goes beyond just the diagnosis or what we are trained to do. It's, again, mind, body, and spirit for everyone. So I think that's extending the healing of Christ. That's what our mission is. That's what we do every day. So it's an honor and a privilege to be able to serve, again, not only our team, but our community and our patients.
Yeah, that is awesome. I think that's a great way to kind of wrap it up and give everyone that all this amazing information, not only about Advent Health, but about Altamonte Springs. And thank you for giving us a look into your lives as leaders too. Things that you've experienced, some intakes on what you have in the nursing field. And I think our viewers and attendees here today really appreciate all of the amazing content that you are able to provide. So with that being said, I know we are at 11:59. Again, thank you, panelists, for your valuable insights and your experiences. And I know we weren't able to get to the questions, everyone, but they are documented. And if we can, I hope that we're able to respond to you But just a reminder that you are able to speak with our managers in person at our hiring event on February 13th at Altamonte Springs. That is just around the corner. So it will be from 9 a.m. to 1 p.m. And we do look forward to seeing you there. Other than that, thank you again for joining. I hope each and every one of you have a wonderful day and stay safe.
Thank you. Thanks for
Thank
joining
you.
us.
Thank you.